the microbiome has such a profound impact on not just increased intestinal permeability, but autoimmune disease and systemic health. And
welcome, Dr. Brad Leech. Thank you so much for giving us your time today.
Jodi, it's fantastic to be here talking about perhaps one of my most favourite topics, the microbiome.
Absolutely, one of mine too. So we are going to have a ball today, I think, and hopefully we cover all the information that we actually want to go through, because we could be talking about different topics about the microbiome within the microbiome for days, as I said just before we got on the recording. So very excited to chat to you about this. All right, so Brad, now I love to ask people where and how they got interested in certain topics. So what brought you into the microbiome?
Well, my career in integrative medicine started in 2008, where I was very interested in autoimmune conditions. I really wanted to identify the root causes for developing an autoimmune disease. And so after I finished my undergrad degrees, I went into research, and I sat down with my supervisors, Dr. Amy Steele and Dr. Janet Sloss, and I said, hey, I would like to research autoimmune disease, and I'd like to find the cure to autoimmune disease. And as they are very senior researchers, they looked at me, almost tilted their glasses down, and they said, Brad, that's not how research works. Research is you choose one tiny area, one small concept, and research that. Okay. So I went away and had a little more think about, what do I want to investigate? And at that time, I was very fascinated with a researcher called Professor Fasano, who discovered the protein zonulin, which is linked with increased intestinal permeability. Anyway, I decided to dedicate my honours, my PhD, into investigating increased intestinal permeability, what practitioners can do, and how do we go about treating it. Fast forward 5 odd years, and I felt like I had researched everything there was to do with increased intestinal permeability. And I came to the conclusion that the microbiome has such a profound impact on not just increased intestinal permeability, but autoimmune disease and systemic health. And that's when I decided to dedicate all that I had to really understanding what the microbiome is, and not just understanding this species and that species, but from a clinician's perspective of how do we change the microbiome and thereby improve our patients' health. So a bit of a U-turn when it comes around to finding this passion for the microbiome, but I eventually got here, and I can tell you this, Jodi, I'm not leaving anytime soon when it comes around to understanding everything we can about the microbiome.
It's such a huge topic, and it's such a beautiful topic, and it's been missed out on in many professions for too long. So it's time we change that and get people's understandings up to scratch with how broadly, as you said, it impacts the whole of our health.
I totally agree.
Yeah. So now, going on to how we can help, and I'm massively on board with this because, again, I love application. I love how learning and then applying the knowledge that we have to help. Otherwise, there is no point, I think, in doing research unless it's going to end in better outcomes for people or for us. Yeah. So what are the benefits of a healthy microbiome? Why are we aiming for a healthy microbiome?
Well, it comes down to a healthy microbiome can significantly reduce the risk of chronic disease, including gastrointestinal conditions such as inflammatory bowel disease, IBS, metabolic syndromes, neurological conditions, anxiety, depression, skin conditions, eczema and acne, autoimmune conditions, and even to some extent hormonal conditions such as PCOS, endometriosis, and obesity, just to mention a few. I actually think I could link every health condition to the microbiome in some way or another. Might be a small link, but I could still make that link between particular health conditions or most health conditions and the microbiome. So a healthy microbiome, it's known to improve digestive function, enhance our immune system, improve mental health, and have a positive impact on metabolic health as well. The microbiome also plays an important role in digestive function, such as motility and producing some vitamins, such as vitamin K. Now, a healthy microbiome can reduce the risk of developing particular biochemical imbalances, such as intestinal inflammation, systemic inflammation, increased intestinal permeability, detoxification problems. So it is absolutely essential to have a healthy microbiome if we want to be in optimal health and live and have longevity.
Absolutely. Oh my gosh, there's so much I want to dive into there. What can we cover in this short period of time? So, how do we, first of all, there's all these things that you mentioned about inflammation. I'd love to dive into those a little bit with you. For the testing that we do in clinical a lot, it's very important for us to come up with these specific markers on how we can test what a healthy microbiome is. So let's start there a little bit. How do we measure what a healthy gut is? What are the key indicators that we're looking for?
When it comes around to a healthy microbiome, you want a high level of diversity. So you've got something referred to as the Shannon index, and this is a very validated marker or calculation to identify diversity in the microbiome. So we want a really healthy diversity. We also want a balanced microbiome. So we don't want any species dominating the microbiome where it's more than 20% of the whole microbiome, for example. Other components is we want the microbiome to be balanced in the respects to the function of the microbiome, so producing beneficial compounds and low levels of pathogenic bacteria known to be potentially harmful. So we don't want high levels of E. coli in the gut because we know that they can produce this compound called LPS or lipopolysaccharides, which is known to be pro-inflammatory for the gut and also systemic inflammation.
Yep, absolutely. And I totally agree. And a lot of the time when we're talking specific diets or specific, carnivore as an example, when we talk about that, it's more down to diversity at the end of the day. Long-term lack of diversity creates an unhealthy microbiome. And I think that's key.
This concept of diversity in the diet links up with diversity in the microbiome. There was a great study, and I know many clinicians would be aware of it, where they looked at the association of the diversity in a number of individuals, those who ate fewer than 10 fruits and vegetables and plant-based products each week, and those who consumed more than 30. And what was found is those that had a more diverse diet had a greater microbial diversity. And we know that a greater microbial diversity is linked with lower levels of intestinal inflammation. It's linked with lower risks of developing chronic disease. And so it is about microbial diversity. So it's diversity when it comes around to what is key for a healthy microbiome.
Absolutely. And we've gotten into, I think, in this treatment of how we treat people these days, or a lot of this FODMAP revolution and, restrict, allergy, intolerance. And I see many clients in my clinic reduce down, as you say, to very, very small amounts of foods. And it's hard to get them back onto those foods again and increase the variety and the diversity of their foods, and explaining to them how important it is for the microbiome and therefore the conditions they're experiencing to actually increase the diversity of their microbiome to protect them. It's sort of, but it's a hard one to explain to people.
Yeah, and I see that myself in clinic, where people come to me with a large amount of food sensitivities, whether it is FODMAPs or SIBO, and they can't have a diverse diet. And I recall one patient who was basically just eating steak, bacon, and eggs 3 meals a day. And well and behold, his microbiome was absolutely terrible. And that was that concept of fear from, should I be eating these particular foods? And so, yes, the microbiome is essential to improve, but then we've also got to work with the patient to go, okay, how can we overcome these sensitivities so then we can increase the diversity in the diet, leading to an improved microbiome?
Absolutely. Absolutely. So I want to just talk about a healthy microbiome in terms of ages. So age-dependent testing, or the differences between, say, a 2-year-old and an 82-year-old. And I know infants are very different in their microbiome diversity, in their markers, in their zonulin, in their short chain, all their secretory IgAs. Anything that is to note for us clinicians to watch out for in particularly age diversity?
Now, this is a very interesting concept. So the vast majority of microbiome research, looking at what should be there and what shouldn't be there, is done in middle-aged adults. Exactly what you said just before. Infants under the age of 2, they would generally have higher amounts of zonulin, higher amounts of calprotectin. That is not to say that they have leaky gut and intestinal inflammation. It's more, I don't think we fully understand. When we take the elderly, for an example, we know as you age, and I'll take an example of a study I read recently where they looked at the microbial diversity and metabolites and particular species of those individuals dwelling in a retirement home village. And what they found was those older individuals who were residing in a retirement style village, they had reduced diversity and they had an increased amount of pathogenic bacteria, especially your hexa LPS-producing species, so your E. coli's. The other concept here, in addition to aging, is also weight. We know that weight can have a profound impact on the shape and consistency of our microbiome, and those with a greater weight may have a higher potential to produce a particular metabolite called branched-chain amino acid, leading on to insulin resistance and type 2 diabetes. So, yes, the age difference in our microbiome can vary quite a lot. The greatest characteristics is that reduced level of diversity seen in older age.
Okay. Yeah, which makes sense. Absolutely makes sense. You know, the way that they're doing young blood transfusions, maybe they can do young fecal transplants.
I've always said if it was a little more relaxed from a TGA perspective, I would bottle up my own fecal matter and sell it on the market from the perspective of I have some great microbiome, some great bacteria in my gut, and I think it could make a lot of people very healthy. In saying that, we can't do that, so we've got to do with the next best thing, and that is really when it comes around to diet.
And I think that's a good point, though. And I was going to ask on a selfish perspective, because I have a fascination with this, and I get a few clients obviously asking me, and those with serious IBD scenarios, and they're investigating and going through fecal transplants, but you know, there's no magic pill. And I think that's important to understand, is that even a fecal transplant is not a magic pill for actually the top down, you know, working with the body, the ins to the outs and the outs to the ins, making sure that we are healthy from multiple aspects, environmental influences, what we're consuming, what we're thinking. All these things have massive impacts on the microbiome. But do you have any other, you know, experience or anything else about fecal transplants and longevity of these treatments?
This is a great question, and I'm recalling some of my gastroenterology friends who I chat with on a regular basis about FMTs, and there's one local that I work with a number of different patients, and at the moment in Australia, it's quite a restricted area, and it is only used when there's a C. diff infection. I personally would like to see more research in the area of FMTs, so then we can expand this treatment. And as you said, there is no golden bullets, but it is a very powerful tool that we have access to. And until that time, we've got to be utilizing the tools that we actually have access to. I have heard of patients overseas who've gone and had this treatment overseas, and they've reported amazing results when it comes around to, I'll take alopecia. So alopecia is an autoimmune condition where your hair is falling out, where an individual had a fecal transplant, and within a 12-month period, hair started to grow back. Absolutely incredible.
Wow.
To determine how long that effect will stay, it's too early to say. But exactly what you said just before on, yes, okay, you've now had all this great fecal matter inserted into your colon. If you do the same lifestyle factors, if you drink high amounts of alcohol, if you have a low diverse diet, if you have chronic stress, if you've got other health conditions going on, then that microbiome will become reduced, and then soon enough you'll be developing the same conditions as you had previously.
Yeah, absolutely. Fantastic point there. Fantastic point. So now, leading on to our next question is what, and we've talked briefly about this already, what does the gut microbiome do for us? Obviously, we've talked about conditions, we've talked about health, but let's maybe talk specific and conditions that you're very well versed with treating as well. And how does that interact with the systemic effect of the microbiome? So we fixed the microbiome. Alopecia was a great example of just then. But what are we looking at? What is the wide impact of the microbiome?
So this is a really interesting question, and an area I feel a lot of clinicians are still puzzled about, this concept of how does the microbiome impact systemic health? How does the microbiome actually link up with alopecia, with inflammatory bowel disease, with constipation? We often simplify it down to the perspective of, oh yes, the microbiome is linked with this condition. But a lot of clinicians, they are somewhat puzzled and confused as to, well, what is this exact mechanism of action? Now, perhaps the most important way that the microbiome can actually interact with systemic health is the production with these small molecules called metabolites. You see, the gut microbiome, they have the capacity to produce a diverse range of these metabolites that can perform a variety of different functions, from impacting intestinal integrity to regulating the immune system to reducing inflammation, impacting hormones. An example of, let's say, beneficial metabolites that the microbiome can actually produce, you'd be very familiar with this, is your short-chain fatty acids, such as butyrate and acetate and propionate. So the microbiome produces these, and these metabolites then have this impact with gastrointestinal health and also systemic health, as they can be absorbed into circulation, the portal vein, and then so forth. But as we delve deeper and deeper into the research, there's a number of other metabolites in addition to these short-chain fatty acids, one of which is a metabolite called IPA. Okay, so IPA stands for 3-indole propionic acid, and it is essential for gut integrity. It's linked with a reduction in intestinal and systemic inflammation, and it's very, very beneficial for overall microbiome health and systemic health. But then on the other hand, you've got metabolites that are not so good. And we've mentioned this one before, your LPS or hexa-LPS, which is a very pro-inflammatory metabolite that is that can be produced by the microbiome. Another, let's say, detrimental metabolite that our microbiome can produce is this compound called trimethylamine, or TMAO, which is linked with inflammation and cardiovascular disease. So we have this concept of, oh, microbiome is linked with cardiovascular disease. And one of the greatest ways that it is linked, there are a number, but the greatest way is through particular species in the gut producing this compound, trimethylamine or TMAO. And so these metabolites, they can affect inflammation, barrier function, systemic inflammation, and so forth. What is also very interesting is these metabolites have also been linked with a number of health conditions. So let's take obesity and type 2 diabetes as an example. What the research has shown is those individuals, especially those with insulin resistance, their microbiome actually have a reduced capacity to produce your short-chain fatty acids and your 3-indole propionic acid. Now, further to this, their microbiome as a collective group actually have a increased capacity, meaning that there's more species that have the genetic code to produce LPS and trimethylamines within the gut. Something I find quite interesting is that there's been a number of human trials where they implement a high fiber diet in those with type 2 diabetes, and there's actually an improvement in blood glucose. And the researchers put it down to improving in the microbiome diversity and the capacity to produce these beneficial compounds in the gut. Now, this isn't just linked with type 2 diabetes. There are multiple conditions. Take anxiety and depression, mental health, for instance. Now, this is an area where it's still in its early stages, but there's this concept of GABA. So we know that GABA is a neurotransmitter that is essential for neurological health, and it's a calmative, but it can also be produced in the gut. And so there is some theories out there that the microbiome's capacity to produce GABA might be linked with anxiety and depression. They're still investigating that. But let's move on to another condition where there's a lot more research, and that's cardiovascular disease. How often do you see in the media? I feel like it's every 3 months. The food we eat linked with cardiovascular disease, or the microbiome, the key to cardiovascular health. Now, although these news articles, they don't go into detail, when you actually dig into the microbiome detail of these studies, you see that individuals with this greater cardiovascular type events, such as hypertension and plaque buildup, they have a reduced diversity, and their ability to produce butyrate is reduced, and they've got more of this hexa LPS and this TMAO getting produced by their microbiome. So that they are just a few of the many examples I could give when it comes around to actually linking what the microbiome does to systemic health. Does that make sense?
Absolutely. And I've got a few things there, and I think it's great that focus on the cardiovascular, because I feel in my practice as well, and I'm not sure if you've seen this or if I'm saying this in the right way, is that there is a bit of a chicken and an egg scenario. So those types of bacteria feed off the foods that those people have in their lifestyles that predominate. And then those foods create more of those bacteria, which create more of the bad metabolites or things that will actually create more ill health. And hence it goes on and on and on. So sometimes with these cardiovascular conditions, those particular types of bacteria will feed off, barbecued meat or, all the foods that saturated fat or the trans fats, those sorts of things that will actually predominate and create more of those health conditions. I'm not sure if I'm saying that in the right way there.
I think you have. It's almost the nail on the head, where it is a vicious circle, but it's a vicious circle that we can change. And it's a vicious circle if we change and we maintain a high fiber diet and we promote these beneficial microbes, then there is that research link to thereby reduce the risk of developing these particular health conditions.
Absolutely. Yeah. So before I get on to, what this means for us as clinicians and how can we, and what does that change for us clinically, I just want to touch on COVID quickly. And it's if you don't want to talk about it, it's all good. But what I've noticed is through any COVID intervention, whether it's the actual infection or a vaccination, I've seen an increased dysbiosis. I've seen an increased intestinal permeability from and inflammation from my testing. So I'm not sure if you have a comment on that, because I think clinically at the moment we're seeing a lot of that sort of stuff come through and dealing with patients in multiple ways with multiple symptoms.
Yeah, I can 100% relate to you, and maybe it was just me, but maybe it's not just me. In that respect, so in the last 12 months, the amount of COVID-related patients I've been seeing has gone through the roof. Of course, that is with more people having COVID. And when I say COVID, it could be in relation to potential adverse reactions. And it could also be long COVID. And that perspective of, okay, what are some of these driving factors? Now, I've probably seen 40, 50 patients with COVID-related symptoms or injuries or long COVID. And I'm coming to the conclusion that everybody's very different. So I had just last week a 30-year-old female who presented with heart palpitations due to COVID-related problems. Would I go about treating the microbiome for that particular patient? Interesting question, and I'm actually going to say no. Even though I love the microbiome, for that particular patient, what I'm finding to be most effective is, yes, addressing these core fundamental principles of COVID, a high viral load and so forth. But then if they present with a cardiovascular related complication, such as heart palpitation, is to actually use our naturopathic training to treat that heart palpitation directly. So almost prescribing the interventions you would to a 75-year-old male who has heart palpitations. In addition to, the general improvements of improving the diet and exercise and so forth. But then if somebody comes and they have a increased exacerbation of their diverticular disease or inflammatory bowel disease, two conditions, patients probably 2 weeks ago, whereby due to COVID, their symptoms have just gone worse, where I've actually seen direct evidence of the marker calprotectin, which is a marker of intestinal inflammation, increasing due to the response of COVID. Now, how would we go about that? Well, we would put on how would we go about treating inflammatory bowel disease and diverticular-based diseases, because they're very much situated in the gut. The microbiome is a huge component. I've done testing on a number of patients with which have had quite a severe case of COVID. And what's quite interesting is there's going to be a higher amount of these detrimental metabolites, such as hexa-LPS, and reduced amounts, especially of IPA, this 3-indole propionic acid. So it's very interesting, and I'd love to publish some case studies in this area, because I feel like it isn't going to change anytime soon. It is something that's going to be with us for a number of years to come, and we need to very quickly come up with some solutions to better support these patients.
Yeah, absolutely. I totally agree. I see it coming in droves, and I also see no resolve at this point for it slowing down, where people are coming in with their symptoms. And I really do feel COVID is a very clever one, where it will bring out those who have pre-existing weaknesses. There it is, there it presents. And I find it fascinating from a clinician perspective and a research perspective. And I'm like, wow, how clever is this thing?
yeah, exactly, 100%.
Yeah. So, I love to systemize things. So obviously we've talked about the microbiome. We've talked about what the microbiome does for us and why we want a healthy microbiome. Now how do we, and we've talked a little bit about how we can pick up on a healthy microbiome and how it's related to certain symptoms and conditions in the body. Now, as a clinician, what are we looking for specifically? And this might come back to, you know, how the advancements around, you know, what's happening in the microbiome in the recent years and what then this means for us. But what are we looking at next in the microbiome?
I think one of the greatest advancements we've actually seen from a clinician's perspective for the microbiome is developing advanced sequencing methods of the microbiome so we can actually have a comprehensive understanding of what the microbiome does. Now, if we look at traditional methods, these methods are mainly culture, and we know that they only sequence a very small portion of the microbiome, and it doesn't actually give us a full, or us as clinicians, a full understanding of what the microbiome does.
Yeah.
Whereas we've got new methods of sequencing the microbiome, especially metagenomics, which allows us to actually dive deep into a species level understanding of the microbiome. Now, with this advancement, we can not only see the vast majority of the microbiome, but we can also identify unknown species. So for the very first time, we have access to this high-end sequencing method in clinical practice where we can identify species which have never been identified in research, which is, I personally find, really, really cool to look at a microbiome report and go, hey, we have a microbiome, a species of bacteria here, which is C71345. It's never been given a name, but we know that it's in your gut. And with this information, we can actually develop personalized treatment recommendations for our patients because we know exactly what's happening within our gut. So to actually better understand this advancement of the microbiome, I think actually taking a step back and looking at the history of how we actually got to the area where we are today. So if you look back at, let's say, the 16th century, that was when the microscope was first developed. So a very long time ago. It wasn't until the mid-17th century that a microbe was actually described. Now, fast forward until the 19th century, we actually cultured the first bacteria, okay? You fast forward until the early 80s, where we developed PCR technology, where we could actually probe in and look at a particular species of bacteria. Yeah. And then our technologies got a little better, and we developed this testing method called 16S. Basically, what this is looking at the genus level of bacteria. Now, it wasn't until, let's say, 2004 that this new sequencing method called metagenomics was actually first published in the research. It took another almost 20 years to get into clinical practice. So we've had access to metagenomics in clinical practice for about 3 or 4 years now. And it's absolutely incredible because I give the example of when we use a culture or PCR-based testing method in clinical practice, you're presented with a list of maybe 20 or 30 different species of bacteria, and it'll give a reading of, okay, high, low, or within range. And this concept of testing, it feeds into this old school, outdated method of weed, seed, feed, whereas we see a pathogenic bacteria, you have Klebsiella pneumonia, we need to kill this, I'm going to give a long-term dose of antimicrobials, I'm going to kill it, my job here is done, I will give some probiotics and prebiotics, your microbiome is cured. Unfortunately, that's not how the microbiome works. We shouldn't be coming in with a machine gun killing species of bacteria in our gut, because this method of sequencing and looking at the microbiome, it doesn't tell us the whole microbiome. It only tells us a very, very small snippet of the microbiome. So we have metagenomics, on the other hand, which is only accessible in the last couple of years. And what it does is it sequences the microbiome down to the species level. And it does this by sequencing the DNA of the bacteria. So rather than growing the bacteria like culture or having a probe like PCR testing, it actually breaks apart the bacteria, gets access to the DNA, reads the DNA and go, based on this sequence of DNA, this is most likely going to be a Akkermansia mucifilii species. And we can understand not only who they are, but what they do, because we're looking at the whole genetic component of these bacteria. We can get a better understanding on their functions, on the function of these individual species. What's absolutely incredible is I mentioned before that we can actually look at species that have never been cultured or never been really identified. But when we look at them on a DNA perspective, we go, great, that particular species, C4, 5, and 6, 7, that's all well and good to have a random number or code to identify the species. But when you're looking at the DNA, you actually look at the function. You go, oh, okay, this particular species, it produces butyrate, thereby it's probably a good guy. Now, when you actually take that step back and you look at, well, how many different species can metagenomics actually identify? To date, it's about 28,000 species metagenomics can actually identify. 28,000 species. That is incredible and unheard of. Now, those 28,000 species, they could be bacteria in your dogs, in your fish tank, out in some random stream in the Himalayas. But when you actually look at the species in your gut, generally, there's around 6,000 species that could be found within the gut of Westerners. Now, on an individual basis, that's generally between 150 to 200 species. So we don't have every single species in our gut, nor do we want every single species in our gut. Each microbiome is diverse and unique. I have looked at multiple microbiomes in my patients, even those who are healthy, and every single microbiome is as different to the next. That's not to say that one's good or one's bad, but when we look at the function of the microbiome, we're not so much worried about who's there, but more so what, as a whole, the microbiome has the capacity to produce. Are they producing good metabolites, or are they producing the nasty metabolites? So I like to think that it's function over species, and it's a very nuanced concept when we look at the microbiome to really change this thinking rather than, or do I have Bifidobacterium longum in my species, in my stool, or do I have Lactobacillus rhamnosus in my species, in my stool? We need to step away from that and go, well, can my microbiome produce enough butyrate? So I actually think that's the greatest advancement in the last 10 years, maybe even the last 100 years, and something that clinicians can use. I mentor a lot of naturopaths and nutritionists, and they are fantastic practitioners. But when you place a microbiome report in front of them and there's 150 different species, they're going to look at it and they're going to go, I have no idea what this means. I don't know how to actually treat a patient. But if we look at what the microbiome is producing, they can very confidently say, well, the patient doesn't have the potential to produce butyrate. Thereby, I'm going to actually support this butyrate pathway because I know butyrate is going to be beneficial for reducing intestinal inflammation, systemic inflammation, improving intestinal integrity. So it's changing how clinicians in clinical practice treat patients with evidence-based medicine rather than old school approaches. So I know that was a lot, so I'm gonna pause and stop there and see if you've got any questions.
I think you answered all of that really well, because I was going to go into, difference between PCR, and I want to see that, what sort of different levels of types of testing have we had over the years and why we've advanced into this method. So you answered all that fabulously. And then I wanted to go into different ways of treatment, which you've gone into. And I think that's so important to even reiterate now again, is that our old way of thinking and treating was, and this is a medical model that we've been used to treating like for many years. And I think it's that general practice of where we're looked at. And we've been sort of stuck down into that narrow field of looking into one specific thing and how we can do more of that. I see low, this particular bacteria, give more of that, that will increase. Well, that's like putting a piece of blue sand into the beach and expecting it all to turn. Like, that's ridiculous. So it's a much more holistic, full, whole way of representing how important and beautifully interconnected the microbiome is with the body, as well as every other type of matrix that we have within the body. So it's giving the respect to it in that way. But I feel that with all these metabolites and how they do have the impact on the body, it's really beautiful. Like you say, you can see what they're producing, what their impact is downstream on the body, and then how to impact those and produce more of that or increase those levels. So it's almost like you're seeing it in a graph form versus an individual form, and you're moving that graph.
Yeah, no, 100%. And it's the concept of the whole is greater than the sum of its parts, where we want to look at the whole microbiome. We want to treat the whole microbiome rather than one individual species.
Yes.
And when we look at the whole microbiome, we can target a particular metabolite. And I think that this is the new approach on how we should be treating patients with so-called dysbiosis. We shouldn't just be classifying them as, you have dysbiosis. We should be taking it the next step further and say, well, there's this concept of functional dysbiosis, whereby it's not just a category of, you've got dysbiosis, here's a multi-strain probiotic and a multi-strain prebiotic supplement, good luck. It's, well, what component, what function of the microbiome is out of range? And then thereby targeting that with personalized medicine to thereby get the greatest clinical results than just focusing on one individual species.
Absolutely. And I want to dive into just a bit of a summary that you will, sort of give us a bit of insight into what that personalized protocol might look like for someone, or what we're trying to use for that, because I think that's really important to follow up with. But firstly, I just wanted to touch base on this comment you made about parasites, that shotgun approach. And I'll have a good laugh to myself, because so many practitioners in the past, and I teach at Endeavour too, so we're chatting about this stuff all the time. It's like, you see the bad guy, you kill the bad guy, and everything's back to normal again. Well, actually, no. And when you see the results of like, okay, we targeted this, we did antimicrobials, we did antibiotics, a lot of the time when doctors have seen clients that I've seen afterwards, they've done the antibiotic protocols and they are horribly worse afterwards. Their symptoms are 10 times or 10-fold worse. So I feel that that approach is definitely not working, and that shows. And so this new approach of, why is it there in the first place? Yeah, they might have contracted it, but what is the imbalance in the first place? What is the lifestyle imbalance? What is the microbiome imbalance? And how do we fix that?
And it is, when it comes around to parasites, and this is an interesting concept, I've referred a number of my patients to have colonic hydrotherapy, where you can actually visually see big long tapeworms and parasites coming out, and it's just like, okay, well, that's not normal and that shouldn't be there. But one of the hallmark features in let's say my clinical practice when it comes around to parasite care is supporting the environment. So if we have a healthy environment, so this isn't just the microbiome, this is also intestinal integrity, this is how much mucus we're producing, this is our stomach acid, our digestive enzymes, the pH, how regular our bowel motions are, our diet, whether or not it's high in sugar or high in resistant starch. Supporting it through that process is key. if they have acute clinical symptoms, vomiting, diarrhea, that are linked with a parasite, then yes, we're going to have to treat that with the medical model to get rid of this parasite, which is, it's short-term loss for long-term gain.
Yeah.
Okay, and in that process, during that treatment protocol, you'd be wanting to support the gut and then come in repair. So I've got a concept, especially when it comes around to the use of antimicrobials, is this concept of test, reflect, protect, regenerate, whereby we want to test, have a good understanding of what's happening in the gut. We want to reflect on those results and reflect on their clinical presentation. And then protect, so protecting the environment in the gut, and then also regenerate as well. So if we have to use antibiotics and antimicrobials, we want to follow those 4 rules of test, protect, reflect, regenerate.
Absolutely. Absolutely. And I definitely use those antimicrobials, but I think it's more of that after impact as well, isn't it? You know, building the clients, creating that safety afterwards and repair, because again, if that's not done, then you're just leading the gut open to more of those infections. Yeah, absolutely.
Yeah.
All right. So what does this sort of mean ongoing? Like, what are we looking at for treatments for clients? And what are we seeing as the best way to individualize the microbiome treatment?
And this is this concept where I used to supervise in clinical practice, and I would frequently have patients, students come to me, present their case report, and they would say, the patient has dysbiosis. I'd nod to myself, you know, they're still learning. I'm like, okay, and they would give a probiotic because they've got dysbiosis. Now, probiotics, they are fantastic. I use them frequently in clinical practice. They're targeted approach for a variety of different components. But I think the important thing for new practitioners and even practitioners wanting to upskill in the area of microbiome treatment is it's very difficult to prescribe personalized medicine to a patient without fully understanding what their microbiome is first. So I'll give you an example. If I had a patient that we measured their microbiome and they had a high potential to produce hexa-LPS, straight away I would know, all right, this person is going to be at that increased risk of intestinal inflammation, systemic inflammation, intestinal permeability. Now, depending on their clinical presentation, they have an inflammatory bowel disease. So quite common to see these two hand in hand. And we know that LPS will exacerbate the inflammation, exacerbate the immune dysregulation. So I'd actually want to bring down LPS. Now, I follow a 3-phase approach when it comes around to bringing down the bacteria that produce LPS. So that's reduce the bacteria that produce LPS. You want to bind on to the LPS, which is already in the gut, so then it's not going to lead into circulation, and then reduce the absorption of LPS as well. So what the research has actually shown is GOS at 3 grams per day for 5 weeks can actually reduce the species of bacteria known to produce hexa-LPS. So here we are, we're using a prebiotic fiber, not an antimicrobial, a prebiotic fiber to almost crowd out the bad bacteria, thereby there'll be less LPS. Now, I'll put in a caveat here, start low, go slow. If you go 5 grams of GOS into somebody who might be a little sensitive 3 times a day, they're going to be not happy because they're going to be coming back with bloating and gas and abdominal pain. Prebiotic fibers, especially your FOS and your GOS, they need to be prescribed at a very low dose for a very long period of time and slowly increase. So that will actually reduce the bacteria. So that's addressing the cause, one of those fundamental concepts of integrative medicine. Another component that I like to implement in my patients with a microbiome that has a high potential to produce hexa-LPS is bovine colostrum. So bovine colostrum actually has anti-LPS action, where it actually binds on to the LPS. Thereby, it's not going to be promoting intestinal and systemic inflammation. The next component is reducing the absorption of LPS, and that is through reducing saturated fats and increasing omega-3s, because we know that LPS loves fat and it gets absorbed through the lymphatic system. And so we reduce this large quantity of saturated fat. And yes, don't shoot me, but I'm also including coconut oil here. Then that's going to be beneficial. Coconut oil is great, but I still have patients to this day who will go adding in 2 tablespoons of coconut oil into their smoothie. And I'm almost shocked, because I look at them, I'm like, hold on, why? And they're like, oh, it's good for me. I'm like, okay, well, MCT oil could be good for you, but it's more about switching out the fat. So rather than using canola oil, using coconut oil. And we're not adding in extra kilojoules and extra fat into a smoothie. So that's one example. Another example I could give is TMAO, okay? Cardiovascular disease. So I think not enough clinicians focus on cardiovascular disease, given the prevalence of cardiovascular disease. Possibly due to the fact that, these are older individuals, and once they're in this medical system, it's quite difficult for them to come off it. But I think we as clinicians need to be aware of how we would go about treating somebody that has a increased risk of cardiovascular disease based on their microbiome. So if a patient has particular species of bacteria known to produce TMAO, or trimethylamine oxidase, then there's a couple of things that we would want to do. The first thing is to reduce high carnitine in the diet. So carnitine is found in kangaroo and beef and other red meat, but it's also found in supplements. So evaluating the patient's diet to go, are you having excessive amounts of red meat? Could that carnitine be going on to produce TMAO? So in the back of your head, you're thinking, oh, okay, this could be the link between high red meat consumption and cardiovascular disease based on the microbiome. Now, what's quite interesting is not everybody's microbiome will have bacteria that produce TMAO. So that red meat component is only going to be applicable to some individuals. The other concept here is, okay, if somebody does have these bacteria and there is going to be a larger amount of TMAO being produced, then we can utilize one of our favorite interventions, and that is cruciferous vegetables. So there's been research with Brussels sprouts where individuals ate 300 grams of Brussels sprouts for 3 weeks, and it reduced plasma TMAO. Now, for fun and games, I thought, let me give this a go. Let me see if I can eat 300 grams of Brussels sprouts for a week. I love my cruciferous vegetables.
Me too.
It was a lot. It was a lot. All I felt like I was eating Brussels sprouts.
That's a good chunk, isn't it?
It's a substantial amount of Brussels sprouts. So we need to take this research and put it into a more clinically appropriate recommendation, where we might go, let's go 300 grams of cruciferous vegetables, because it has that component, diidolylmethane, DIM, which is this active component that's preventing this conversion into TMAO. So 300 grams of cruciferous vegetables, when you've got broccoli and cabbage and cauliflower, Brussels sprouts, it's going to be a lot more achievable than just chewing down on Brussels sprouts.
People don't have the best opinion of Brussels sprouts, do they?
As long as they're covered in tomato sauce. No.
I like them in butter. Butter's good.
Butter is nice. So that's an example. I can go on. Would you like me to give you a few more examples?
Yeah, let's go for definitely one more example from my behalf, because I'm thoroughly enjoying this.
Which I know it could get a bit repetitive, but this is personalized medicine at the forefront. So I'll give you the choice. Do you want to hear about personalized medicine for the microbiome for someone who's got a low potential to produce IPA, or a low potential to produce butyrate?
Ooh, butyrate, please.
All right, let's go butyrate.
You're an adventure here. I love it.
Join us next week as we talk about IPA. Okay, so butyrate. Now, if somebody has a low potential to produce butyrate in the microbiome, this is where it gets quite interesting. When we actually look at actual butyrate in the stool, so we can measure actual butyrate in the stool, we need to take this with a grain of salt, because the actual amount of butyrate could give us a false positive and a false negative understanding of the bacteria in the gut that can produce butyrate. So I'll give you the example. If somebody has undisclosed constipation, they're more likely to have a low level of butyrate. That is not to say that they're actually producing enough butyrate. That is because the butyrate would be absorbed in the gut because they've got constipation, the bowel, the fecal matter will stay in the bowel for a longer period of time, thereby we're able to absorb the butyrate. Whereas if someone had quite fast transit time, loose stools, when we measure their actual butyrate, it could come up as really, really high. But they may actually have very few species of bacteria that produce butyrate from the perspective of, well, they're not absorbing any of the butyrate because it's just going straight through them. So that's why I really like to look at the bacteria that produce butyrate, because I feel it gives me a better understanding on the potential rather than what is found in the stool matter. So the biggest things here to increase butyrate producing species of bacteria are going to be resistant starch. So this is going to be your banana flour. Now, a research article came out probably about a month ago now, and I shared it on my LinkedIn, and it almost went viral. It was my most viral post on LinkedIn, looking at how the ripeness of food will change the fiber content. And so if you've got a green banana, the amount of resistant starch in a green banana per 100 grams is about 18 grams, so quite high. You compare it to a ripe banana, with a couple of brown dots, you're looking at 2 or 3 grams, so a lot fewer amounts of resistant starch. So green banana flour, excellent way to go bringing in resistant starch into the diet. Another one is your resistant starch type 3, which is your cooked and cooled rice and potato. Not as nice, but it's still an option, and it still has substantial evidence to show that it increases butyrate. A few others to mention would be inulin. So actually prescribing inulin. Now, a caveat here is with methane. So archaea within the gut can actually produce methane, right? Especially your M. smithii component of these bacteria. What's quite interesting here is M. smithii produces methane and will actually feed on inulin, right? So if you go prescribing inulin to somebody that also has M. smithii in their gut, that may, improve their butyrate, but it may actually make their methane, thereby their constipation, worse. So a little caveat there on inulin use. The last fiber I'll mention that will support with butyrate production will be your beta-glucans, so from oats.
Beautiful, beautiful. I love the practical application of all of those, and I love that they're available from food and not only supplements, because a lot of the time we rely purely on supplements, and a lot of physicians and clinicians are purely looking at what they can do from a bottle or a powder perspective. And it's not really giving clients long-term benefit of taking charge of their own health. So I think this is fantastic for that too.
No, diet is definitely key. And when it comes around to, let's say, just general things that I would say when it comes around to supporting the microbiome, I love the concept of feed, feed, feed. And when I say feed, I'm referring to fiber. I have not seen a patient, or very few patients, that are actually eating enough fiber. We need to be adding more fiber into the diet, and diverse fiber. And you know what we put on top of this diverse fiber mixed plate of food? we add on a little sprinkle of fermented foods. And that there is the recipe for good microbiome health.
That's beautiful. And I was going to ask you that. One last question is, what's your fun idea about the perfect microbiome plate? And you've just done that. So amazing. I just want to finish off there. What is the recommended amount of fiber? Now I hear, obviously research differs with this. And my point of reference is maybe around 30 grams. What is yours?
I go with the suggested dietary target of 28 grams for females and 38 grams for male. That we have evidence to say not only will it support with microbial health, it's going to support with cardiovascular health, with weight management. It is a lot of fiber, but it is achievable. It is achievable, and trust me, you do it for a week. When you have a bowel motion, you'll thank me. You'll go, that was the best bowel motion of my life, because you have that little bit extra fiber in your diet.
Absolutely. The perfect poo, I call it. And my clients come in and we have a laugh and we're like, did rainbows come out? Did unicorn sprinkles come out? They're like, it was like a party. It was the perfect poo.
A really good indication of good gut health and good systemic health is a healthy bowel motion before breakfast every single day, which is easy to pass, which is well formed.
Yeah, beautiful. And we've even covered off the perfect looking, style, timing. Wonderful. Love it, Brad. So good.
Fantastic.
Oh, thank you so much for your time. I think it's a perfect way to end the podcast. We covered amazing, and then we ended with the perfect poo. So
it's been an absolute pleasure chatting all about the microbiome, and I'm always keen to talk more. I love this subject. I could talk for hours.
Oh, absolutely. Me too. We might have to get you back on for part 2 of Choose Your Own Adventure.
Sounds fantastic.
Thank you so much, Brad. And I will chat to you later. Thank you.
See you.